Do you have pain that's deep in your buttock? Maybe it travels down the back of the thigh, or maybe it's worse when you sit on that side. I'm Anthony Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT, and today we're going to talk about a commonly overlooked condition called piriformis syndrome. In my practice, I'm often sent patients who have pain deep in the buttock, and they've been diagnosed with sciatica, pain shooting down the back of the whole leg, which is commonly caused by a slipped disc in the spine pinching the nerve. These patients have often had an MRI scan which has shown some what they call degenerative changes of the disc, some wear and tear. But when I look at their scans, I'm not that impressed with the amount of compression seen. Therefore, a diagnosis we have to consider is piriformis syndrome, which often mimics sciatica. So let me explain this. The sciatic nerve is, think of it as a big cable that runs down the back of your leg, and it innervates all the different muscles in your leg. This cable, this big bundle of nerve, is formed by individual nerves that come out of the lower spine. So any compression of those nerves will give you pain in the buttock and shooting down the back of the leg. Now, deep in your pelvis, in the glute area, in the buttock area, there's a muscle here called the piriformis muscle. It comes off the bottom of the spine, sort of near the tailbone, above the tailbone, and goes out to the hip. And it's one of the muscles that helps with the movement of the hip, specifically rotation of the hip, outward rotation. That muscle overlies the sciatic nerve. Now, if there's any damage, strain, inflammation, or spasm of that muscle, it can give you localized pain in the muscle itself, so deep in the glute. But then when it starts to irritate the sciatic nerve, it will also give you pain going down the back of the leg. Excessive use of the muscle or an imbalance in the way we use the two muscles either side can cause the strain on that side. But something else I've spoken about in another video is the sacroiliac joint. That's the joint between this big pelvic hip bone here and your sacrum of the spine, the bottom of the spine. This joint doesn't move very much. It's basically a shock absorber between your legs and the spine, but inflammation or wear and tear in that joint can also cause strain within the muscle. The diagnosis should be from the clinical assessment as opposed to fancy expensive scans. So if putting pressure deep on the buttock, such as when you're sitting or even when your doctor examines you, putting pressure deep on the buttock, if that really triggers it, that often tells you it's the piriformis muscle rather than sciatica caused by a slipped disc. And that's important because I have seen patients with some minor bulging of the disc that's been misdiagnosed as sciatica. And in worst case scenarios, I've even known patients to have undergone surgery for a presumed slipped disc when it wasn't really the source of their pain. Sometimes an MRI scan can help to confirm the diagnosis as well. Now, the good news is in most people, it will just settle down. It almost never needs any surgery or anything invasive. Often physiotherapy, specifically stretches to stretch out the muscle if it is enlarged on the scan, or even sometimes exercises to strengthen it will help. In very rare circumstances, an injection of a steroid within the muscle or around the sciatic nerve just beneath it can be helpful. If the muscle is very enlarged on the MRI scan and things are not improving with stretches of that muscle, then an injection of some Buttock into the muscle itself to help shrink it can also be helpful. You might find my video on sciatica, pain shooting down the back of the leg, useful, and also the information on the Spine MDT website. There are links below. If you found the video helpful, please don't forget to click the like button and subscribe to the channel. Thank you for watching.